Hello friends, greetings for the day. Myself Dr. Dev Kumar Jha, pediatric pulmonologist and intensivist, New Delhi and NCR. Today I will describe in short about advanced mode of ventilation. So conventionally we use pressure controlled ventilation or volume controlled ventilation, and better than these two is flow controlled ventilation. And the advanced mode of ventilation which I am going to describe in short is NAVA. NAVA means NAVA, neurally adjusted ventilator assist. In this mode of ventilation, there is a catheter called AD catheter, in which there is NG tube fitted with electrode, and it is passed through the nose into the stomach, and it detects signal from the diaphragm. So in this mode of ventilation, diaphragm and phrenic nerve should be intact, so that the signal from the brain goes to phrenic nerve and then diaphragm, and then it is detected by the catheter. So patient initiates breath, and it is supported by the ventilator. So ventilator supports according to the need of the patient. So patient decides what kind of need is there, and then ventilator assists it. So this is the most advanced mode of ventilation. To know more about this NAVA ventilation or other modes of ventilation, and to know how to operate ventilator in a correct way to treat critically ill patient in PICU, that is Pediatric Intensive Care Unit, please join Fellowship in Pediatric Pumonology with hands-on training of Bronchoscopy under aegis of Respiratory Foundation of India. Thank you very much. Take care. Be aware.